Hi, I'm Dr. David Loh, and today I'd like to tell you everything you need to know about liposuction. Today's video will be done in 4 parts. The first part, I'll explain what is liposuction, what the procedure is like, and what kind of recovery time you can expect. In the second part, I'll talk about the common areas that are requested for liposuction. What are the risks and the various types of power-assisted liposuction. In the third part, I'll talk about other procedures which are commonly associated with liposuction. In the fourth part, I'll explain how you can maintain your results over the long term. Now let's quickly go into what is liposuction. Liposuction is a procedure where we go under the skin into the subcutaneous fat layer, which is above the muscles, to remove the fat cells, fat deposits from this area. What liposuction does is it brings an area of disproportion back into harmony with the contours, the curves of the rest of the body. What liposuction isn't is a method of weight reduction. There are various ways which are very effective these days for treating obesity, and liposuction is definitely not one of those. The liposuction procedure goes like this. On the day itself, we'll go to a day surgery. There'll be another doctor and anesthetist who will administer sedation for the patient to keep the patient comfortable, while I will focus on the liposuction. The liposuction involves 3 steps. The first step is to infuse the area with tumescent solution. This tumescent solution distends the area so that it is easier for us to maneuver within that layer. The second step involves using some form of energy. It could be sound waves, it could be vibration, it could be water jet, to loosen up the fat cells so that the third step is easier to perform. The end point of the third step of the liposuction is when the desired shape is achieved. And then the patient will go to a recovery area and rest. In the recovery area, my nurses will be doing some massaging to expel the water solutions that are within the areas, put on a compression garment, and the patient can go home and rest. The recovery time is like this. We do not recommend that our patients go out on the first day because the anesthesia might make them still feel a bit groggy. The day after the surgery, patients can they are always mobile. There's no need to lie in bed. The recovery time is not like that. They can take a bus, drive a car, meet friends, and do stuff. But their movements may be a little bit slow, especially if the extent of the liposuction is quite large. Going to work depends on the nature of work. If it's Zoom meetings and casual kind of meetings, I guess second, third day, the patients can go back to these activities. Going to the gym is another matter altogether. If you're doing activities like running, which bounces a lot, that might hurt the areas of liposuction. However, on the 5th or 7th day, if the patient goes to the gym and maybe does a bit of light cycling, a bit of weights, that is perfectly okay. The compression garment is advised to be worn for the first couple of weeks. The main reason is during the phase when the swelling is on the rise, we will compress the area so that the patient is more comfortable. The swelling and the bruises will typically take about 2 weeks to maybe 1 month to slowly go away. Areas that are commonly treated with liposuction include the saddlebags. Saddlebags are these protrusions on the outer thighs of some ladies, which no matter how much exercise they do, it will never move. And bringing the area back into proportion, into harmony with the rest of the body is classically one of the best things liposuction can do for this area. Another area of concern are the fat accumulations on the chest of male patients, so-called male boobs. It gives them a lot of lack of confidence. So removing the fat from this area improves their quality of life to a great deal. Other areas that are commonly treated include the abdomen and the flanks. The flanks are the love handles. In both male and female patients, these are quite commonly requested. Another area that is commonly requested is the double chin and maybe the fats on the cheeks, as well as under the arms for some female patients. Let's talk about the different types of liposuction. You might have heard of names like Vaser, micro-air, water jet. These are all power-assisted forms of liposuction. Remember, I mentioned the 3 steps in liposuction. The second step being that we use energy devices like this internally to break up the fat cells, loosen them up, so that the third step, suction, is an easier job for the surgeon. So what these power-assisted liposuction methods does is it helps the surgeon do a better job at the end of the day. However, there's no one that is superior over the other. It really depends on the experience of the surgeon, whether the surgeon uses Vaser, micro-air, or water jet. He alone is the one that's able to deliver the best results for the patient. So what are the risks and downsides of liposuction? If you really look at the instruments that we use during liposuction, they're designed to move only within the fat layer. It is almost impossible to injure the blood vessels or other parts of the body with all the devices. So complications with liposuction are extremely rare. What sometimes happens is we have suboptimal results. And the reason for suboptimal results is because probably of patient selection. For example, if there's a lot of loose skin already pre-existing, if we deflate the area further, then we're going to worsen the loose skin condition for the patient. Similarly, if let's say there's a lot of visceral fat component in the belly, for example, a belly bulge, removing the subcutaneous fat may not deliver the optimal results in reducing the bulge. Let's talk about the other procedures that are commonly associated with liposuction. The first is fat transfer, also called fat grafting. The fat that is removed during liposuction can be re-implanted back into another part of the patient's body to augment or to enhance it. I'll be doing another video to explain the ins and outs of fat transfer. Do watch out for it. The second procedure that is commonly associated with liposuction is cellulite subcision. The fibrous tethers which cause the dimpling in cellulite occurs in exactly the layer that we're doing liposuction. So it is pretty convenient when we're doing liposuction to also break these fibrous tethers which cause the appearance of dense cellulite. The third procedure that is commonly associated with liposuction is a skin tightening treatment called Bodytite. There is also Renuvion in the market, which has similar results as Bodytite. These are add-on steps after liposuction to tighten the skin so that we can minimize on the appearance of loose skin after liposuction. How do you maintain the results over the long term after liposuction? Remember that during liposuction, we're removing the fat cells from a particular area so as to sculpt it to bring it back into proportion with the rest of the body. Therefore, the main thing to do is to maintain your weight in the band of plus minus 1-2 kg for the long term. And in this situation, the area that has been treated will not regain again. We hope you have gained a better understanding of the topic of liposuction after this video. This video was produced in relation to a blog article. The link is below in the comments. Please visit the blog to gain even more insights into the topic of liposuction. Thank you.